Let's welcome Professor Magy.
Hi. Thank you. So this is a work that I have been doing for a number of years. Before I moved to Northeastern, I actually was working with a game company or a social media company that was developing a game for health. So we discussed design and started from there. And now the game is now up and on the web, and we've been collecting data, behavioral data, mostly from people who are playing the game. We have about 500 users that have been playing for a long time. So we decided when I came here to basically look at the efficacy of the game in terms of behavior change. So we've ran several studies, and so I'm going to start discussing what these studies are. Some of them are exploratory, and now we're moving more to more formal studies. So I'm collaborating with several people, Maria, Chico, and Carmen from Health Sciences. There's a postdoc that was also working with us, Shri, who's actually giving birth next week. And we have also the social media company. The CEO is always in all of our meetings as well as collaborating with us. The aspect of having a commercial game helps a little bit because they market. Probably we need to close the door. Can you close the door? Okay. So having a commercial company is great because they are handling all the business side of it. So everything from marketing to the target market that they want, building the product in a much more professional way, and collecting the data and keeping that in track. We're doing more the research side of things. But also working with a company is hard because they have a say on what their employees would be doing and what features they will be implementing design-wise. And so we have to show them enough evidence that there is a problem with specific things so that they can actually change the design. Some of this work, if I can get this to work. Hello? I think it seems to be frozen. No, it's gone. So some of this work has been funded by Northeastern internally and the company, because the company has to do some work on the game itself. And Aetna Foundation has started to actually fund some of that work as well. So the bigger problem, and I'm sure all of you know the problem, we're basically tackling the obesity problem. And we know that this obesity problem is actually rising. It was projected that by 2030, you have 86% of the adult population will be obese. There's been a lot of work that you probably have seen, like tracking systems like Fitbit or mobile-based tracking systems, and that will help motivate people to exercise by looking at, by visually seeing what they are doing over time. There's also been games for exercise, like hooking a racing game on a bike or a treadmill, or even using a Wii Fit or others, or for example dance. A lot of people actually use the dance, either the dance pad or the Kinect now to do dancing, and that also helps with exercise. There's been also narrative quests based games. An example is Zombie Run. But most of the games and other technologies have focused on more like technological aids, stories and games, or game-like incentives, so maybe gamification, so doing a social media and then adding gamification in there, or doing a visualization system or a Fitbit or a mobile-based system and then adding gamification in there. The challenge that I see is that the design still has to have very high adherence and engagement. And I'm going to differentiate between these two. So adherence meaning that you kind of like adhere to playing that game or doing this exercise for a longer period of time, and maybe have some consistency in that exercise. Engagement meaning you're doing more. Every time, every session that you're going in there, you're doing a lot of different activities in there. So if you're doing a dance game, for example, you're dancing for 20 minutes, you're dancing for an hour, or you're dancing for 2 hours. These are different. So you're engaging with the game in one session differently. If you're doing a dance game, if you're going and dancing every day, then you're adhering more if you're doing that in a month or a year regularly. So these two factors are really important because if you want to stimulate behavior change doesn't happen in a day, and it doesn't happen in a session. It happens over time. So time component becomes important. And that is really important for two things, for design and for evaluation and tuning the design. So at this moment in time, I think we really need to have a theory of some kind to discuss how the design of mobile devices, technologies, or games, or design features in games can affect adherence and engagement. And also a methodology in terms of whether you're doing user studies, qualitative, quantitative analysis, what kind of test scores are you using, what kind of surveys, methods, if you're using survey methods or behavioral methods you're using to evaluate summatively and formatively. So meaning formatively, like you're designing something and you're getting something out, you're going to evaluate so that you can redesign. So design tuning becomes really important, and we need to have a methodology for doing that. So these are the two needs that basically we'll be talking about. A lot of people use games because games increase engagement and thinking that they increase in adherence too. Actually, that's not true. If you look at the statistics, there is actually really low retention in games, especially social games. There's 85% of gamers, for example, quit social games right after one day. Right? So Fold It, which is a great example of a game that has been used for citizen science kind of research, has a retention of 10% of people basically stick to it after 1 week. If you look at mobile applications, you also see it declining. So this is the 12th day, and by the 4th day, you already are 20% of your users. Same thing for games. These are different kinds of games. So you have role-playing games, single-player games. Single-player games actually have to have a lot better retention than social games. Social games have the worst retention, but it depends on the game. Some games are better than others. But the fact that you have to still work hard on the game design to actually make it so that it will have high adherence and high retention, as well as high engagement. So that means that you actually do need to have a really well-articulated theory of like how do the design features really increase or not, or are linked to adherence and engagement, and how you actually tune your design to do that. So I'm going to use a case study, and not necessarily that this is the best case study ever, but this is a game that we have developed with a game company. It's commercialized, and we have enough data from users to actually start looking at retention, specifically adherence and engagement in this game. So this is a game that was developed by a company called Ignite Play. It's called Spa Play, and it's online. It's been online for a number of years. The idea of the game is basically designed for a specific market for women between 30 to 50 years old. So they basically did their research and figured out that most of the people who are between the age group and women are basically playing a lot of Facebook games. So they looked at the Facebook game designs and found out that social aspects are important. Achievement aspects in this game is really important too. So they designed the look and feel similarly to some things that you see like Farmville. But the quests and the specific activities that you do in this game is linked to real life activities. So this is like an activity feed of your friends and you, of things that you'll be doing. And the things that you'll be doing are like things like squats, head rolls, taking the stairs, and you get points for these. So you self-report. You basically go and take the stairs and come back and say, I'm done. I did this. You can select to basically take a quest and, for example, a quest of this is doing a healthy choice. So you watch a video that basically gives you an idea of how to do squats, and then you start doing squats. You can do it by day, you can plan it however you want. So you're doing 2 squats here, and then you have to do 3 squats and then 4 squats. And you get points for all of these. These points translate into the game of things that you can unlock and make your environment more beautiful, and also you get coupons outside to purchase other things like makeup and maybe more food. So yeah, so as I said, you cannot unlock things. There are some mini games inside this environment where where it's linked a little bit more to healthy activities, yoga being one. And the yoga game is, again, it's a very simple, using the same mechanics as a game like Bejeweled. And so you're playing Bejeweled, but you're trying to get it to a position that is known in yoga. And you get also superpowers. These superpowers that gives you a little bit more things to unlock inside the game are based on points that you are getting from exercises that you have outside of the game. Inside the game also you can track things. So it's using the same idea like Fitbit, kind of visualizing and tracking your activities. So this is kind of like your cabana, and you can go in and basically add friends and look at how well you're doing. You can competitively look at yourself versus your other people that you have, other friends that you have, if you're competing with them with weight loss or anything that you want, or for example, how many stairs did you climb. All of this you can actually look at the visualizations and compete, or you can do a non-competitive version, which a lot of our users also like to use, which is that's just seeing your friends and then seeing what their experience points are. Do you have a question?
It's still self-report, right?
It's all based on self-report, but I will talk about other things as well. So yeah, interrupt me anytime because I'm gonna go over a lot of other things. So yeah, and you can see visualizations of things like, for example, this is me, and I haven't done anything the past 13 days, or yeah, the past few months. And then all of a sudden I did a lot of things in the game and got some more points. So you could see over time how well you're doing it, and there's a theme-based graph. You can do things with friends, so you can walk with friends, you can do quests with friends. So you can, if you add a friend to the game, you can also go and say, I'm going to take this quest of like eating a lot of fruits, and then we'll go together and do it, and you can look at each other's data as well. There are some casual games. There's a yoga game. There's also a chef game, and the chef game actually has recipes, like more healthy recipes, and it's a diner dash game, basically, where you are putting together a salad, but it gives you an idea of what kind of salads you can put together, and the recipes are contributed by the users from the game. So the current state of the game, as I said, has been in development for a long time. Yes?
So you mentioned that users could spend their experience points or something to buy food or makeup or something.
They get coupons.
Or coupons.
Mm-hmm.
And also that this is a self-reflected or self-reporting game. So what's to stop people from just saying, oh, I climbed 4,000?
Yes, everybody asks that same question. I'll get to that answer, but let me just first tell you several things that that the game has added. So there is integrated sensors in there. So they've integrated the Runkeeper, the Fitbit. They had another sensor that they have integrated as well. So that's the physical exercise piece. So you don't have to self-report everything now. The sensors does it for you. They couldn't do that exactly with food because it's harder. So that has been integrated in 2012, and there is a mobile version because a lot of users basically didn't want to go to the computer and then say, okay, I had a squat, and then I go and do some squats, and then you had another squat. So mobile version was easier for them to add in things. So this is still going on. In 2013 they started, and they are finishing it. They're doing testing right now. So the question of why users don't actually are more honest, or are they? What we found out is that when we're collecting a lot of data, so in the very beginning, that's what users do. Like, I want to know what I'm going to be getting. So they click, done, and you could see it in the data. You could see like big spikes all the time because people are just going in, trying to figure out how to maximize the game. As it turns out, people who are staying there longer than 2 days don't do that anymore. They start over. And the coupons are not enough motivation for them to actually keep them going in the game to get to the coupons. So most of the people that we have now, there are 500, at least from the behavioral data, they are not really doing all these clicks. At least there's no spikes in the graphs. And the company has been holding these workshops with the users. The users would come in and then discuss it with them. Most of the people who self-select this are really honest about making a behavior change for themselves because they self-select to actually get to the game. And so they said that the honesty wasn't a big problem. Okay, so this is the game that we decided to actually run some studies on. So we ran the first study that we ran was an exploratory study. We really wanted to know, getting back to that idea of the need of understanding theory about the design features and how they are linked to adherence and engagement. So we did a mixed method study where we actually had 18 participants, played the game for 46 days. We wanted them all to be homogeneous because there are not that many participants. It's a mixed method study, so that there is a lot of qualitative data, which is why the number of participants. And we collected demographic information about their gameplay experience, their exercise and eating habits, their gender and ethnicity. So we had 14 male and 4 female, 15 white and 3 Asian. And this is kind of like what their eating habits, exercise, and video games. So if you look at the video game data, for example, you can see that most of them actually play a lot. 1 to 3 hours, 4 to 5 times a week. While only 5% play hardly ever. If you look at their eating habit, many snacks, well, these are university students, so you have 50% of them snack at least 1 or 2 twice a day. And only only 16% snack hardly ever or between 1 to 2. And if you look at the how many, this is kind of like the physical exercise question, and you can see that they are not all of them kind of exercise. They're kind of like all over the place, but 44% of them don't really exercise at a high rate. And at a moderate rate, they're split between 1 to 2 times a week and hardly ever. Yep.
These data are before they start.
That's before they started. Yep. Yep.
So since the game was designed mostly for women from 30 to 55, was the study for male participants?
Yeah, well, that's a good question. So we actually advertised it in the university and basically said we want game players. So, so the sample had like a lot of guys, and there was nothing else that we could do to basically encourage more female participants. But we did have a lot of interviews to make sure that actually there wasn't a turnoff based on just the way the game looks or the actual gameplay features of it itself. So the way we structured the study was to have an interview every week, and I'll talk a little bit about how we structured the interview because it's not free form. We collected in-game behavior data because we have access to the database where all the data of the game is being collected. So we have everything that they did, from clicks to sparks, quests that they did in the game, and when they did them. So we have it's not just like aggregated of data, but actually data over time. We built a methodology for figuring out how to deal with longitudinal data over time and how to interpret and also use the interviews effectively. So the way we did that was every week we will process the data so we know what they did in the game. We did some visualizations, and then we construct the interview questions based on these visualizations. The interview questions will have about 3 parts. The first part is general, understanding their context, what they did in their lives, and how did they actually use the game inside their life. How did they integrate it with their life? And then the second part was basically looking at the data, having the visualizations of the behavior, having them annotate the visualizations so that we can contextualize the behavior within the context of their life. So if, for example, they opted to do a quest of eating fruits or taking the stairs, we would ask them to tell us at what context they actually use this quest. So it might be that they come every time they come into work, they take the stairs rather than taking the elevator. It might be that instead of taking one example was instead of stopping at the stop where the ruggers stop, for example, they stop earlier and they walk towards the class, that kind of thing. So that allows us to contextualize the behaviors that we're collecting. And then the last part, we're asking them to interpret these behaviors in terms of their goals, in terms of weight loss or exercise or eating healthier. And then we take all this data, we transcribe it, and then we analyze it. So the data from the game, I talked a little bit about the data from the game, but the data from the game are basically log in, log out, so we know when they had sessions, interactions with the objects inside the game, what they had in terms of quests. Quests are the ones that I showed you, like what kind of quests did they have, when did they accept it, and when did they actually complete it, so they can complete it over a week, they can complete it over a day, and so forth. So all of this data is actually time-stamped, and so we could do any kind of sequence analysis on it. So with visualizations of game data, we were able to look at unusual patterns, repetitive patterns, as well as allow the users to contextualize their actions. So these were important for us to kind of uncover things that you would normally not really uncover by just having an interview. After that, we took the transcribed interview, we coded it. We coded it in multiple ways. We have actually run several analyses on this data. So the one analysis I'm going to actually talk about is particular to adherence and engagement. So we know there are several theories about adherence and engagement, as in particular towards a game. For example, the player experience need satisfaction is a model that's based on the self-determination model that explains why people might adhere to a specific game. It has been looked at in terms of game design and retention. And the model is based on self-determination theory. So you have competence, autonomy, and relatedness are the three basic constructs behind which these are measured. The adherence and retention is measured. So we looked at the interview data and basically coded instances where they were talking about challenge as competence, instances where they talked about freedom or control as autonomy, and social connectedness as relatedness. And most of the time they'd be talking about them as either positive or negative. So we labeled them as either positive or negative. So you'll have positive autonomy, positive competence, positive relatedness, and so forth. The other model that we used was lifestyle. We found that when you have technologies that are integrated to someone's lifestyle, it's easier for them to actually adhere to it or build a habit around it. So there are several theories around lifestyle, so we thought we'll use that as a construct also to code the data. So if the data has anything about integrating the game inside somebody's lifestyle in that context, we will also label that excerpt and also label it as positive or negative. And then we used just one of the game design theories, mechanics, dynamics, aesthetics model, and we used basically just mechanics and gameplay, so the dynamics out of that model to label things that people might say about the game, about the mechanics or the gameplay of the game. So these are kind of like the codes that we came up with. I'm not going to go into all details, but you can stop me and ask me questions if you want. But as I said, you're labeling based on the self-determination model, positive relatedness, negative relatedness, positive competence, negative competence, positive autonomy, negative autonomy, the mechanics, the gameplay, and integrability to lifestyle. So we what we did was take the whole game and the whole 46 days, and then see how did people adhere over time. And how does it look compared to other things? We've seen the graph kind of go that way, right? So it's going the same way for this game. So it's not really any better from other games, but you could see some spikes, like some people are still playing, but not a lot of participants are playing for a long period of time. And I must say that some of this is actually influenced by the interview, because we have interviews at day 7, at day, like every 7 days or so, except for spring break. So sometimes you can see spikes right before the interviews. Yep.
They all start at the same time? They all start at the same time?
The same week, but they're not all like, we didn't get them all in one room and say start.
This would be like a summary of all individuals.
Yeah, so this is the number of participants, and day 0 will be whatever day 0 is for that participant. And since Maria is here, so actually can take questions about the analysis, since she's done the analysis. So we have looked at the total number of active days, like on average for all participants, and you could see that it's 7 days for over the 46 days. So they didn't really, they weren't active that much out of the 46 days, but there's also a lot of variance. There's a 7 day of variance. We decided to actually look at other measures to see how they are consistent over sessions of play over time. So because that's a big measure of adherence, how did they actually adhere over time? So we looked at the length between logins. So if I log in at day 1 and then I logged in at day 7, there's a length of 6 there, right? So the length between logins, so the mean length is actually 7 days, with again high variance. And then we looked at, is there any variance between the, is it regular that you're playing the game every 7 days, for example? Or is there changes in that regularly, the period that you have between sessions? So the standard deviation there is 4. And again, there is some variance, meaning that people are kind of consistent, probably within the 4-day range. The level of engagement, again, the average is 39. So this is 39 activities, with again very high variance. There is a lot of people who have done more and some people who have done less. So the adherence is not very high. There is a lot of variance there. There's also a lot of variance in engagement. So we wanted to explore further. So we wanted to see what is the connection. So how can we explain this variance? What is the connection between the design elements and what people said about the design? And how does that implicate these variables of adherence and engagement? So we used the codes from the interviews, the positive and negative, for the PENS model, the game design model, as well as the integrability model. And we looked at correlation between these variables, and the adherence variables, which are these 3, and the engagement variable, which is basically how much activities did they do. So I'm going to just point out some really interesting correlations that we found. We found that by far autonomy actually has a big influence. Specifically, positive autonomy had a big influence on adherence measures. Specifically, that actually it does encourage more adherence. And it has a negative influence, which is interesting, with engagement, with the number of activities that you do.
Comment on that?
Sure.
How do you explain that?
That is odd.
It's a negative correlation and a strong relationship.
The other way. So the engagement is a number of activities. So the number of activities in this game is related to how much exercise you're doing. So people who basically might just have been clicking on different things, the number of activities go up, right? And you don't really expect them to be doing 50 things in one day, right? If they are really going to be engaged in more consistently with behavior change. So the people who are more consistent did less activities, basically, in the game. We found a pattern where a lot of people basically go in the beginning, as I said, and kind of try different things, and then don't really go afterwards because they kind of figured out the game. So we explained this that way, but I think the interviews kind of explain it a little bit. It's different for different audiences. The other interesting part is that the game at that moment, especially at that moment in time when the participants were playing, it had only friends in terms of like you can add friends, but it was cumbersome through the interface to actually add a friend. So, and there wasn't so many social factors that you can actually do. So, in terms of relatedness, which is like the social connected aspects, there weren't so many social connected aspects. So there was a lot of negative utterances around that, and especially for people who are more motivated towards that end. And you could see that actually the negative aspects in terms of relatedness also affects the adherence measures a lot more, and it's not really this is not really big enough, but it's just like looking at the adherence measures. So meaning that maybe if the game included a little bit more social aspects, this will be better. You'll have a better adherence. Yep.
Just returning back to Holly's comment, that also the negative alternative has the same correlation, same direction.
Yep.
So that's interesting.
Yep.
That both deviations from average, I guess, that cause you not to be engaged.
Yep. Yep. But the negative autonomy did not have any adherence measures, so you can't really.
Right. No,
Yeah. Yeah. Yep.
Kind of a tangential point to social relatedness.
Mm-hmm.
Was there any outside of the game communication? So, for example, like an email every couple of days saying, like, did you do your workout today, or your friend passed you experience points or something? Was there anything outside of the game?
There are some things inside the game, but it's not about, encouraging competition or encouraging you to do something in the game. It was more it's very subtle. So things like, oh, there is a community challenge. Oh, you logged in yesterday. That kind of thing, so that it will encourage them to come back. Anything else? So the interesting thing to point out here, the game was not about competence in terms of achievements. So competence had no effect whatsoever on the adherence or even on engagement, which is interesting because you have the flow theory that discuss a lot about competence being a really important measure, especially if you're gamifying a system. It's not always the case. I mean, you can gamify the system without really looking at competence, but maybe adding competence here could have added something. But the game itself did not really have a large mechanics around competence.
Wouldn't you interpret this that the self-determination theory is not really a useful concept?
Well, it's useful for drawing out these. But this is why we actually looked at others, right? So this is the next one. So, this is why we looked at integrability specifically, and also game design theory. So what's interesting is, so integrability, we knew that it would have an effect because, as you know, there's a lot of theories that discuss how lifestyle, if you have something that can connect more to lifestyle, then it will have high adherence. So you could see that there is a high adherence here, and nothing on the negative integrability. Sure.
I would also was wondering whether there would be a time of the day effect.
Mm-hmm.
Whether you would observe people who have certain characteristics would be morning and more adherent. So,
well, yeah.
The sequence of the time series more carefully might reveal some interesting.
Yeah, we had, so I'm not reporting in these results now, but I think we had a lot of other papers discussing the specifically qualitative aspects of the interview. So one aspect, for example, that we found a lot was that people started to do a lot of things at 5 o'clock. and nothing during the day. So we picked up this as an unusual pattern. So we asked the participants to kind of comment on the context of when they're doing this. And so one of the things that we found was that they don't have access to computers when they're going to school. So they go, do the things, and then they come back and then just track it inside the game. So it's like they're using the game as a tracking system. So that by 5 o'clock, they are basically putting everything that they've done in there. We've seen about maybe 97% of the subjects doing the same thing, and it was kind of interesting. So they weren't doing it like quite in real time. That would change probably if they have a mobile device application. But yeah, this is a pattern that we picked up. There's a number of other small results like that from the interview questions also. So we also looked at the gameplay and game mechanics. Mechanics meaning that they talked about the rules in a positive or negative way, and gameplay they basically talked about the dynamics of the game, the experience of the game itself, in a positive or negative way. So the game experience didn't have anything on retention and engagement, but interestingly, the game mechanics, when they're saying positive things about the game mechanics, the number of days that they are active is more. And when they're saying negative things about the mechanics, then their level of engagement is more. Probably because they had to play so that they can actually comment on the mechanics. Yep.
I'm just wondering if you could separate the data that you feel is bogus, the people that are clicking just to kind of game the game, versus the ones that stay engaged over a long period of time and more likely to be using it in the way it was intended. It seems like the level of engagement is picking up that early data. Have you looked at that?
We didn't separate them, but that's a good point. We could go back and separate them. We know that only we have one participant who did that, but it's not like all of them did that.
I see. This is still counterintuitive.
Yeah.
It's correlation.
Yep.
Do you have a slide?
Slide for the mean? No.
I'm curious to see,
Mean of.
like the mean of these values. Like what's the range?
She had descriptive statistics with it.
But none of. You mean like the standard deviation and mean of these specific. So of these variables up there.
Yeah.
Yes. This is what they are.
What about
The positive and negative autonomy.
yeah.
These are numbers of utterances. We didn't have a mean and standard deviation on these.
Oh, so you count the
Mhm.
numbers.
Mhm.
How many times they mentioned that?
Yeah.
Yeah, I'm just curious because maybe that if you have 16 people, right?
18.
18
Yeah.
people. And the way of speaking versus the actual psychological attributes, like are they going to be a really good indicator or?
You mean like their utterances might not reflect the content?
Yeah, I'm just wondering in terms of the measurement, would that be a good measurement to what you want to measure?
So what we try to do is normalize the number of counts. So for example, if they, let's say that somebody has discussed positive mechanics, negative mechanics, 100 times, 200 times, and then somebody else have discussed it 100 times, discussed the same construct maybe 300 times, 200 times. We normalize over all of them, so that we can figure out how much percentage of the things that they have discussed is towards that construct. So if I always talk about integrability of the game to my lifestyle, that means that's really important to me, or to my experience with the game. And then we made the interpretation. We basically had the code, and so we took the utterances that they have and made the interpretation to these constructs. So in conclusion, kind of like this is kind of what we took away from this exploratory study. So we looked at competence wasn't really effective, but autonomy and relatedness had some aspects that affect adherence. Integrability did affect adherence, and some specifically negative mechanics actually affected engagement. And what we wanted to do as a next step, now that we have something to tell us that some of these constructs are important, some others are not, is to do some more evaluation on these metrics, and especially look at these metrics in terms of behavior change and over time.
So those, sorry,
No,
those,
go ahead.
like autonomy relatedness, those are attitudes about the game, right? People expressed when you interview them at multiple times. Is that true?
It's specific aspects of the game.
Okay. And so I would expect those not to change very much from maybe the first or second time you played the game. Did you look at that? Did they actually change a great deal?
The utterances over time depends.
What percentage of time they talk about mechanics versus something else?
We haven't looked at that. I wouldn't expect them to change, except if they have a lot of variance in terms of how much they actually engage in the game. So if in the beginning they are basically just exploring the game and didn't do much, and then in the middle they kind of tried to really, because they knew that there is an interview coming, or they knew what kind of questions we had in the interview, they kind of like wanted to come back and do something more in the health side. Maybe they explored other things that they may not have explored before. So I could see some changes could happen between the first and the second. I'm not sure between after subsequent ones.
These were Northeastern students?
Yes,
Do you know what their majors are?
we have that information. Yeah.
Demographic, I mean, I wonder if more like, you got
Game
students, they're looking more mechanics, you have psychology students, they're looking more at things like, they're focusing on different things given their...
I'm sure that they were. Yeah, I'm sure that they were.
I mean, it's sort of interesting to try to disentangle what is kind of the game behavior and what's the player behavior.
Mm-hmm. Yeah. Yeah. Yep.
Along those lines, I was wondering if there would be a way to look at those variables sort of unobtrusively and objectively,
Mm-hmm.
like errors that they make, or the duration that it takes them to do something,
Mm-hmm.
would be then related to the mechanics of the game, and to what eventually we could build a theory that would actually be
More factuals on the behavioral data. Well, this game specifically, yeah, I think the game specifically is hard to do that with, because there aren't so many actions. But
It might be interesting to think about games that would give you more opportunity to
yeah,
have measurements that would be more objective.
yeah, yeah, yeah. Yep.
I'm curious about the compensation you provided to the participants. That so they play the game and get coupons.
They get gift certificate,
Could you elaborate?
a $20 gift certificate from Amazon, I think.
$25.
$20.
So $20.
Mhm.
So if they finish the game,
There is no condition.
so as long as they
Yeah,
they get money.
yeah. As long as they come to the interviews and at the last interview they get the gift certificate. There is no requirement on how much gameplay they have to do. Mm-hmm.
So did all 8 participants come back to all interviews, or was there any dropouts?
There were dropouts, but not from the 18. So we had 24, and we've taken out one person because we knew that they are just like they were gaming the system and they were not interested in health whatsoever. And so that one person basically, after first interview, basically dropped the data off. Mm-hmm.
Can you explain competence again? What the concept was?
Well, in the game doesn't really have that, but I'll show you what. No, this is. So basically, yeah. So it's basically the challenge or achievement part of the game. So if you think, do you play games? What kind?
A lot of multiplayer first-person shooter games.
Okay, so first-person shooter games will have quest levels that you have to complete, and these are all achievement-based. You can you may have a skill level if you're a multiplayer game, and then you're basically changing your character skills, for example, over time. These are all achievements that you're doing. So the challenge, so it's challenging you to kind of go up the skills and up the levels. So that's what competence is around challenge, around achievements.
Because I was thinking, I think that the power of socialness
Mhm.
would be a very critical factor in how often your users play a game.
Mhm.
Because inherently, fitness and sports are social things.
Mhm.
So yeah, I was just thinking.
Yeah, and so that's more where social connection would happen rather than, so it doesn't have to be competing against another person. It could be collaborating with another person, right? And so we'll put all of that under the social connected aspect. So that's relatedness. But I agree with you, that's an important component, whether that happens inside the game or outside the game. So the company is now doing like workshops for its users to come in together and talk about their experience. That is a social aspect outside of the game, but that's motivating them to actually go back to the game and maybe add these people as friends and do things together. So yeah, so some of that might actually happen outside of the game, not just inside the game. Okay, so I wanted to just spend a few more minutes to discuss where we're going with this. So we had several, as I discussed, we have a lot of data. We have interview data that I didn't actually discuss here, more qualitative, that kind of sheds some light on some of the aspects of the game that may have been also successful and how did people integrate it inside their lifestyle. But we also wanted to look into a longer-term study, not just as 46 days. So we ran another study, and we're now doing analysis on it. That is 3 months, and it's bigger sample, so we have 47 participants. And we are actually looking at behavior change. So we did a baseline, and then we're looking at behavior change within a 3-week interval, specifically in terms of BMI, nutrition knowledge, and physical exercise. And we're currently doing some analysis on that data, so I can't really discuss all of the analysis. At first, we were encouraged because there was it showed really a behavior change happening, BMI, positive BMI results, as well as positive nutrition knowledge results and physical exercise results. Now we're unpacking, going back to the same idea of like looking at really that the game actually do that. How much did they actually adhere to the game, and how did that actually factor into these results that we're seeing? Is it just the demographics? Is it just the people that came to the study and were persistent enough through 3 months of that study, were actually persistent to have a behavior change or not? So we're kind of like unpacking some of these. And at the same time, the game itself is changing to accommodate for a lot of its users' requests in terms of having mobile aspects, adding more sensor data, adding some genetic testing as well. And the CEO has been receptive to kind of look at all of our results as well. So this is, I think, where I want to end and take questions. James?
So you mentioned the game is actually being commercialized, and I think a pretty good question for health in general would be how does the company plan to make money on the game? How is the game planned to become it?
Yeah, that's the question that I don't want to answer. This is why we have a CEO who's basically doing a whole business plan. Currently, it's been all funded by either foundation funding or Canadian government funding. So there's nothing, there is a business model, I'm sure, but they haven't been instantiated yet. They are right now just testing how that affects people. And then at the later stage, they will add monetization inside. Yep.
So if we are really interested in the theory of adherence, I would hope that we could design games where we can change the parameters of the game. and actually look at the effect. So good game designers know essentially what makes people hear what's more likely to work. Right? So use the intonation at the beginning, but then determine design the game with such parameters that you really have low versus higher mechanics.
Yes.
Maybe
Yeah.
Actually, so at one point I thought, the one unbounded returns 75% of the money, right? But if it returns 75 cents every time you put a dollar in, we were more in game.
Yeah. Yeah.
So it's
Yeah.
the uncertainty that's associated with characteristics like that rather than the mechanics or part of the mechanic would be very interesting to investigate because then you could really determine the theory without resulting to these sort of big notions of the psychological theories.
Yeah. Well, yeah, I think when we first started working with the company, that was the idea, but the company was still struggling to figure out how to add all the components that it needs to add. So they are short-staffed. They can't just tell us, here is a programmer. So what we could do is once the company has actually fulfilled their goal, which is the mobile, they have been trying to go mobile for a while. Once that happens, we can actually embed one of our students in their lab in Vancouver and have them develop that variation, an A/B testing kind of platform for us to do kind of look at the design with and without specific features. That was the idea, but I think we haven't done that yet because of just the short staffing of the company. But our next results, once we finish all the analysis that we're doing, we're probably going to go there.
That theory would also have to involve some metrics on the game.
Yep.
Right?
Yeah, yeah.
That would be interesting to actually develop a structure, framework within which we could actually do that. I'm interested in this because we're using games for training intelligence.
Yeah, well, the platform of the whole A/B testing and doing analytics and figuring out where do people go and how to tune the parameters so it becomes a little bit more better design-wise, more engaging or more you have more attention, has been done with games all the time. Like Candy Crush is kind of like engineered that way, right?
So what are the results then telling us what we should be doing?
They are not publishing results, right? Because that's their company's secret. But the self-determination model, which DC and Ryan has developed, they have a company called Immersive. This company actually does A/B testing for game companies, and they are coming to work with us, I think, next semester. So you're more than welcome to join the group and have that discussion. But they are embedding A/B testing and embedding the theories as well, because they come with a large theory of the self-determination model.
I'm sorry, I don't. Maybe.
One more, and then we can go. One more. Yeah.
Okay, so the problem with the theories like that, they are based very much on the instruments that you use, questions, exact questions that you ask, and a different set of questions might come up with different results. And we would still use the same theory. So the uncertainty about the relationship between the actual latent components.
Well, actually,
and the questions, right? It introduces maybe a variability that you might not need here.
yeah, we are talking about converting their model from a self-report questionnaire model to a behavioral-based model, which then, yeah. So that's actually what we're going to be discussing with them when they come over.
Very good.
Yeah.
That's very interesting.
Yeah. Yeah. Yep.
Since you're mentioning BMI,
Mhm.
project, I'm just curious, for the participants right now, recruited, are they overweight or obese at baseline, or?
For the new study, I don't have the data on me right now, so I can't really tell you. There are some that, they're all over. They are not students, so they're all from all over Boston. There is some underrepresented groups. There are some people who are overweight, some people who are not. But can't tell you what's the percentages because I don't have it on.
I think the averages are around like 5. So that's the average BMI.
Okay, so that's a good start actually.
But
It's not
yeah, but one of the inclusion criterion was that they had to be in the pre-contemplation stage of the TTM.
Mm-hmm. Yeah.
In terms of the physical activities, the game is asking you, is that also being advised by some exercises like this that actually lead to weight loss? Because the slides you showed early on, like one of the physical activities they have to work was like squat.
Mm-hmm.
It's like 1, 2, 3. So I'm just curious about the caloric expenditure, like 3 squats versus actual weight loss in terms of what's needed.
Yeah, no, there is no plan from a personal trainer or something like that to basically show you the graph of like how many of these quests will actually amount to how much weight loss or changes in BMI. That was supposed to be part of the program. So it's the game is supposed to be part of a bigger program where you have a nutritionist and you have a workshop where people get some of that information. So no, the game does not tell you exactly that this is what you should be doing.
Working with the colleague of Amy's, previous colleague, Bonnie Sprinkle, is none of this stuff. We discovered that when you look at the averages, you get certain patterns of behavior, but they are very different, very huge individual differences.
Yes, yeah.
And it paid for us at least start classifying
Different users.
individuals.
Yeah.
And it would be interesting to see whether the classification that you would do on the basis of the theory and the classification of behaviors would be relevant.
Yeah.
Because it would give you a better picture. In other words, you don't look at individual correlations, but say principal components or something like that.
Yeah. Yeah, I'm thinking that even lifestyle would be a big factor there too. Yeah.
I think the thinking was to go that way, but with 18 people from the first study, we couldn't do any sort of classification.
We didn't have any, because you have a sequence, you have a time series. And
Yeah.
you can compare, so for example, you could do a Fourier transform and look at the periodicity and see.
But we don't have the continuous data, so
I know.
ideally it would be if every person provided data on a daily basis, then we would have almost 50 time points. So we would have time series, but right now we have, like the average was five days of play. So if
7.
we have 7 days, so 7 data points, we can do individual analysis with that. So we
We
can.
could maybe look at it.
Well, maybe in the new study with the 47 participants.
Yeah, I was sort of thinking of this too. I mean, if you still need enough gameplay behavior, but if you dummy code the games they don't play as a 0 score, so you have a complete time series that's equally spaced, and look at the autocorrelation, I almost wonder if dependency in the data could help separate out different kinds of behavior.
So I think that even my points potentially have the structure.
Well, we have the data, so we can look at. I think especially with the new study with the 47 participants. Yeah.
Maybe we'll have a little PHI data hackathon.
Yeah.
Yeah. Yep.
So if you take a sort of a 20,000 foot view of your experiment, so you have fairly polished visual game, right? And you had gamers who came in, but if you actually look at the data, it's actually, they're not that engaged, right? And the 7-day mean thing really should jump out because it drops off very quickly and then it's just 7 days. And so I suspect if you didn't have the 7-day interviews and they weren't in a study, it would be even more sort of discouraging, right?
Well, we looked at the 400 people that are now in the game without the interviews, and I think they are the similar pattern. In terms of like every 46 days you'll have 7 days of play kind of thing. So I did ask actually the same question, whether that's actually is an artifact of the interview or Because if there's an artifactorial interview and we have 4 interviews and they engaged for 7 days, then it's really because of the interviews, right?
I think that's sort of my concern with the data. And given that it's a fairly complex game, I find it sort of discouraging, right? Whereas going into a slot machine parlor is encouraging, right? Because that's a very simple game, effectively, that's been engineered, very, very highly engineered to human behavior to sort of get at Misha's point. And I wonder whether there's a way to do this type of work in that type of context, right? More of a Candy Crush type of game that actually can be manipulated to get at the engagement. Because I, as somebody who would like to use games, I find this actually discouraging, not encouraging. Right? That there's all that work and the compliance is still falling off. And then even in the very professional games, or sort of generally for games, the compliance or the adherence, or sort of
Going down, yeah.
engagement is falling off very quickly, right?
Yeah.
So to do research to really understand the behavior, I wonder how we get from here to there.
Yeah, and I think that's kind of like what I'm trying to get at with that point, is that I think a lot of people are taking up gamification because they think any game would actually do, but that's not the point. It has to be very highly engineered. And so when we started with this game, it was to basically look at engineering it by looking at the factors that influence people to kind of engage in it and see if we can then manipulate these factors. Can we then get a little bit more engagement? Because we're not just wanting them to come and then do a bet and go, right? It's about them changing their lives as well, and then just coming and doing something and leaving. So
I think the problem is if you don't get there, if they're not coming in and engaged, you're never going to get the change in behavior. And that would be my concern on your second study. Actually, 2 concerns. One is if you don't have a control group, you're probably in trouble to begin with, right? But the second one is even within that group, if they're not regularly logging in and playing, it's really not going to matter what else you do. And for my health collaborators, I actually have a hard time convincing them of that. They essentially say, if we build a system that's health related, we want every touch point to be about that health related concept. And I try to push back on them and say, you can't do that. It's not, that's not the way to get the engagement. And they'll sort of acknowledge, well, if we don't have engagement, that's a problem. But they don't really want to focus on the engagement. They want to focus on the behavior change, but to get the behavior change without
you have to have,
engagement seems very
yeah.
unlikely to happen.
Yeah. This is why I think what I was trying to say was basically that we do need a theory about that, what the design features are. And this is kind of like what Candy Crush did, but never really published their theory.
But maybe we should work on Candy Crush.
If you can transport that into a health domain.
See, the alternative to the theories of the personality is reward.
Reward-based, yeah.
Use lower process models. What is it that enables people to make those decisions rather than sort of these vague characteristics that people quantify? So that may be a useful way to think about it. Because what happens with the slot machines is basically the reward structure, dopamine system is kicking in, and people get this high.
Yeah.
I think that's what you want to get.
So how do we get people addicted, basically, to health games?
That's $2 million.
Yeah.
Dopamine release mechanic here, though, rather than a slot machine, where slot machines are based on variation, the chance of getting the goal. Whereas this is, you're getting that release from achieving a goal that you've been setting out to step by step conquer.
So the point is there is a reward system.
Right. Yeah. That's it.
And there are many different rewards. Identifying it, taking advantage of it.
Yep.
What we would like to do in design again.
Yeah. We can have
Sorry, one more kind of unrelated question. Back in one of the first slides, you said 86% of the world was projected to be obese.
Yeah, that based on
Yeah,
some.
I was going to talk to you about that.
Okay.
Where's that coming from?
I think you have to adjust your numbers.
I thought, well, it came from statistics from, I don't think I cited the source.
'Cause that seems a bit unbelievable.
Yeah, it could be a projection of overweight or
Overweight, not obese.
Oh, okay.
And that's
That
a
may be.
projection which you have to be careful about because it's leveled off a little bit.
Yeah, okay.
That would be a real problem.
But it says obesity by state. I didn't make this slide up. This is actually the picture from the source. So it says obesity by state. I'll dig up the source and let you know which one is.
The projections.
Oh, the projection is not correct. Okay.
Those numbers look right to me.
On the right.
Yeah.
There are numbers on the right.
Yeah.
It's about 30% in the middle of the country.
Yeah. Okay. Okay. Thank you. Thanks.